Hey guys, and welcome to Medical Zebras. Today we are going to talk about alpha-1 antitrypsin deficiency. Before we go into the specifics of the disease, let's talk about physiology. Well, in the lungs we have tiny little air sacs called alveoli. And these alveoli have a protein called elastin, which gives the alveoli its elasticity, meaning that we can expand and retract the lungs and breathe in all this beautiful oxygen to keep us alive. Well, when there is an infection in the lungs by bacteria, viruses, or other causes, we activate the immune system, and that includes neutrophils. And neutrophils are our protection against infection, and they fight the infection. And one of the things that they produce is called neutrophil elastase, meaning that it can damage elastin. If they produce too much of neutrophil elastase, well, it can be a byproduct of damaging the bacteria to be damaging the alveoli, which contain elastin, which neutrophil elastase can damage. And this is where we talk about alpha-1 antitrypsin, which is the protein the body produces in the liver to counteract the effects of neutrophil elastase, to save the alveoli from being damaged. Antitrypsin attaches to the neutrophil elastase, rendering it dysfunctional. So, what then happens if we lack alpha-1 antitrypsin in the body? Well, that just means that we can neutralize the elastase, and we have too much of it, meaning that we are at increased risk of damaging the alveoli when there's an infection in the body or when we smoke, because smoking, or the smoke that comes down into the lung, actually damages alpha-1 antitrypsin. If you already have some kind of deficiency of alpha-1 antitrypsin in the lungs, well, your likelihood of developing emphysema, which is just a damage of alveoli, is increased. So let's talk about the genetics. The gene that produces alpha-1 antitrypsin is called SERPINA1, and this disease, alpha-1 antitrypsin deficiency, is autosomal recessive, meaning that you have to have one mutated gene from your father and one mutated gene from your mother. And when those two damaged genes come together, well, we have the disease. And the protein it SERPINA1 produces is alpha-1 antitrypsin, like I said. There are a couple of notable mutations that are most talked about. The normal allele is called the M allele, then we have the S allele, and then we have the Z allele. And I just wanted to mention the F allele. It's not that common, but I wanted to talk about it because it's so common that to rule out alpha-1 antitrypsin deficiency, instead of checking, like sequencing SERPINA1, most often it's just a blood test where alpha-1 antitrypsin is measured in the serum. But if you have the F allele, well, then you produce normal amounts of alpha-1 antitrypsin, but the protein is defective, meaning it just doesn't work, but you have normal amounts. So you can't 100% rule out alpha-1 antitrypsin deficiency just because you check the serum level of the protein. I mean, it's super rare, and the suspicion of alpha-1 antitrypsin needs to be relatively high, but it can't be 100% ruled out. So that's something to keep in mind. But the most notable mutation and the most pathological one is called Z. This mutation causes the protein to be, it is folded incorrectly, and it can lead to the entrapment of the protein inside the liver cell, meaning it can cause with time damage in liver cells. And that's why we sometimes see just elevated liver enzymes in the blood with no apparent cause in the patient. But it also, because of the entrapment, we see low alpha-1 antitrypsin because it cannot get out of the liver cell as it should, and thereby it's not traveling to the lungs. The S mutation has been looked at as a pathogenic mutation, but recent research has shown that it is not as pathogenic as we used to think. There is no liver entrapment here, and it decreases the amount of alpha-1 antitrypsin a tiny bit, but if you are homozygous for the S mutation, you're not considered to have alpha-1 antitrypsin deficiency. Your status is or risk is kind of the same as if you were a carrier of the Z allele. And like I said, alpha-1 antitrypsin is produced in the liver. And here we have a graph, and I wanted to show you guys because here are the levels of serum alpha-1 antitrypsin in the blood, and here are the genotypes, and then you can see the relative amount that you can expect to see in the blood for each genotype. And there is this protective threshold that has been defined, meaning that as long as your levels are above this line, you are protected, meaning that you are not increased risk for developing emphysema and you're considered to be normal. Like we see here, if you have both the normal alleles, you are above the threshold and you're not at increased risk for developing emphysema or liver disease. If you are a carrier of the Z allele, as you can see, you will be most often, you're going to be above the protective threshold. But if this patient starts to smoke, remember, smoking causes the alpha-1 antitrypsin to be defective, meaning you kind of cause effective deficiency of alpha-1 antitrypsin if you smoke. That means your levels of alpha-1 antitrypsin are going to fall below the protective threshold, increasing your risk of damaging the alveoli and thus increasing your risk of developing emphysema. So if you're homozygous for S allele, as you can see, your levels of alpha-1 antitrypsin are going to be normal, but the same as if you are a carrier, your risk is increased if you smoke. Then if you have one S and one Z allele, 10% of those who have S and Z are going to fall below the protective threshold, meaning that they are at increased risk of developing emphysema. So they should be seen by a pulmonologist and then lung function checked regularly. And of course, they should not smoke, protect their lungs. If they're working with chemicals or certain irritants that can irritate the lungs, they should wear a mask, like those who are homozygous for the Z allele. So I wanted to talk a little bit about the frequency. Well, alpha-1 antitrypsin deficiency is quite, as you can say, it's a genetic disease, so it's rare, but it's kind of common among the rare diseases in the Western world. So, and the carrier frequency for the Z mutation is 2 to 5% among Caucasian European people. Like I said, SERPINA1, when you have the Z allele, there is a liver entrapment, meaning that it can with time cause liver damage. So what you can see is in newborns, you can see prolonged jaundice, or you can just have an adult male or female that has elevated liver enzymes but otherwise seem healthy. So keep that in mind, especially if you live in the Western world. One thing that can happen in newborn, and it's extremely rare, but it can happen, that the newborns develop severely affected liver function, and some of them so serious that they need a liver transplantation. This is extremely rare, but it can happen. So if you have a newborn that has elevated liver enzyme, always check for mutation in the SERPINA1 gene if the cause is unknown. What I wanted to add here is that because many physicians just check the alpha-1 antitrypsin levels in the blood to see if you might have alpha-1 antitrypsin deficiency or be a carrier or so forth, it is so important that they also check the CRP levels, because if there's an infection in the body, if the CRP is elevated, it's going to elevate alpha-1 antitrypsin in the blood. So you don't see the real amount of alpha-1 antitrypsin under normal circumstances. So if CRP is elevated, you can't trust the alpha-1 antitrypsin. It might be normal just because there is an infection in the body, and as soon as the infection is gone, the alpha-1 antitrypsin level is going to decrease. So always check the CRP levels at the same time you're checking the alpha-1 antitrypsin levels in the serum. What you should also keep in mind is that estrogen hormones can also affect the amount of alpha-1 antitrypsin levels in the serum, meaning it increases. So check the CRP levels and the estrogen, because these two things can affect the levels of alpha-1 antitrypsin and are not reflecting the true level of the alpha-1 antitrypsin production in the body. So keep that in mind. So you reached the end of the video. If you liked what you hear, please subscribe to my channel, and if you have any suggestion on which diseases I should cover, please comment below. Thanks guys, and I hope you have a wonderful day.